Hello and welcome to this week's Adventures in Anatomy, or actually it's medical terminology, but of course, all of the anatomical pieces, parts of your body are named, and those names are part of medical terminology language, in addition to all kinds of other stuff that are going to describe what is happening with the pieces, parts of your body, and what is being done to help the various pieces, parts of your body. Okay, so today we're going to talk about the nervous system. Isn't that exciting? Okay, now remember, the nervous system is the electrical system of the human body. Okay, and there are essentially two parts. There are two parts physically, but there are also two parts. There is the autonomic nervous system, which is the part of the nervous system that works without you having to think about it. And that's a good thing, because this is the part of the nervous system that tells your heart to contract, which keeps your blood flowing. Very important. It's the part of your nervous system that tells you to breathe. Okay. And both of these examples are incredibly important, because think about how much you could get done in a day if you had to sit there and say, heart contract, heart relax, heart contract, heart relax. Oh, wait, I forgot. Breathe in, breathe out. Okay, you're not getting anything else done. So the autonomic nervous system is going to take care of that for you. And that's, as I said, very important. And then you have those parts of the nervous system that you control with purpose. So for example, you want to reach for a glass, okay? Your nerves tell your muscles to extend your arm and to control your grip. Okay, so everybody works together, which is one of the amazing things about the human body, how the different body systems work together in harmony to get a particular job done. Okay, so we are also now going to focus on the two physical aspects of the nervous system, and that's your central nervous system and your peripheral nervous system. Okay, so let's go ahead and take a look at the central nervous system, which is your brain and your spinal cord. Okay, and this is the hub. This is the main server for your nervous system of your head. So I mean of your body. So we're going to start with the brain, and you may remember that your brain is mission control. Okay, and by the way, if you've never seen the Pixar movie Inside Out, you should definitely watch that. Okay, because you have little people in the control panels, you know. Okay. No, you don't think so? All right. Actually, this is part of the autonomic nervous system. And it's important that you know that brain and cerebrum are not interchangeable. Okay. The cerebrum is actually only one part of your brain. The brain is the whole thing, and then you have your skull, which is your cerebellum, okay, that keeps it not only compact, but protects it. But remember, we talked about the skull when we talked about the skeletal system. Okay, so different parts of your brain control different functions, and you'll read about that in your chapter this week, okay? The front lobes are voluntary muscle movements, as I said, okay? Your brain is telling your muscles to extend and contract, okay? Motor areas for speech, it's known as the Broca area, which enables you to form words. Personality, which is why people with frontal lobe damage have personality and behavioral problems, as well as the intellect, critical thinking, memory, judgment, which is probably more colloquially the origin of when somebody forgets something and they tap their forehead. Okay, but that's actually what you're doing is you're kind of like, hello, wake up in there. I need to use that brain cell, that memory, or I need to figure this out. Okay. And then we have those autonomic, those involuntary functions, cardiac activities, that's your heart, remember, and of course, emotion. Then you have the fissure of Rolando, which is the central sulcus. And remember, the sulcus is it's kind of a groove, okay, that lies between the frontal lobe and the parietal lobe. Now, the parietal lobe, which is here, okay, so you have the frontal lobe and parietal lobe, and the fissure of Rolando is here, okay. The parietal lobe functions with interpretation and coordination of sensory information. So when you smell something, and you go, oh, what does that smell like? That smells like cherry blossoms. That's your parietal lobe working, okay? Your right parietal lobe, and remember, right and left is always patient right or left. The right parietal lobe processes sensory data from the left side and vice versa, okay? Which is why, if you've ever heard the joke, they say that people who are left-handed are the only ones who are in their right minds, because it is opposite, okay? So if you smell something with your left nair, your left nostril, it's being processed by your right parietal lobe. Okay, that's more funny than it is interesting, but I still think it's interesting, because why in this case would it switch sides? Nobody knows. Okay. Then we have the lateral sulcus. Remember, lateral is side to side, right? Is the line between the temporal lobe and the frontal and parietal lobe. So take a look at your illustration there on the left-hand side, and you can see I'm trying to find it. Lots of words on here. Okay. All right. So the line between the temporal lobe and the frontal and parietal lobes. So your temporal lobes are here, right? Don't you call this the temple? Your temple, right? That's the temporal lobes. These function your senses, smell, taste, hearing, as well as interpretation of spoken language. So, which is very interesting, don't you think? Although, when you think about it, spoken language is auditory. So that is, hearing is one of your senses. So we have smell, taste, hearing. But in this case, it goes further to interpret what you are hearing so that you can understand this. Okay. The parieto occipital fissure is the groove between, go ahead, figure it out, the two parietal lobes. So we have the right parietal, the left parietal, and then we have the occipital, which is the base of the skull, the back of your head. And that processes visual impulses, impulses as in the feeding of information through your eyes. Okay. Now, your spinal cord is attached to your brain via C1 and C2. That's the first two cervical vertebrae. The spinal cord, remember, goes in the middle of the vertebrae. That hole in the center of the vertebrae, that's where the spinal cord goes. And that the spinal cord is kind of like conduit. When you see them laying these big well, it looks like a big wire, but inside are really all these bunch of little wires, okay? So that they're all contained. That is, your spinal cord is containing all of these little, all of these little nerves that are coming from your brainstem. And then they split off into your peripheral nervous system, which we're going to talk about in a minute. Now, the one other thing that I want you to know is, which I find also very interesting in the design of the human body, is that the spinal cord does not go all the way down the entire spine. It ends right about L1 or L2, which is approximately at your waist, okay? And then it becomes the final distribution of the nerves that will then go into the lower half of the body. So your pelvis, your abdomen, and of course, both legs. Okay. Are you with me so far? Yes, you are, because you're smart. Okay. And then we have the individual spinal nerves. So these are the nerves that are within that spinal cord conduit. Okay. And I apologize if we have some engineers in the audience that if I'm using the wording correctly. Okay. The cervical nerves, and this can be confusing, so I want to give you a heads up. Okay. Remember when we talked about the spine, when we talked about the skeletal system and how the vertebrae in the spine are referred to in sections: cervical, thoracic, lumbar, sacral, coccyx, and then they are numbered: C1, C2, C3. And that way, when you get to your job, whatever job it is, and you know that the procedure being performed is happening on T3 and T4, you'll know that that's the third and fourth vertebrae, the thoracic vertebrae. But the nerves, the individual nerves that are coming down through the spinal cord, in the spinal cord, are also referred to in the same way. Now, chances are you will be working with a neurologist or an orthopedist. Remember, orthopedists are the specialists that work with the skeletal system. And then we have neurologists that obviously work with the nervous system. Okay, so chances are the context of a reference to C3, for example, will not be easily confused. Is it C3 the nerve or C3 the vertebra? Okay, but still, You got to pay attention to the details. You got to pay clear attention. Now, everything seems very logical so far, so we're going to throw a monkey wrench into this and say, even though there are only 7 cervical vertebrae, the bones, there are 8 pairs of cervical nerves. Thank you very much. And remember, pairs, because we have right and we have left. Okay. So therefore, the C8 nerve is actually originating from T1 vertebra, the first thoracic vertebra. Because if it was simple, anybody could do this. I'm just saying. Okay. We have the thoracic nerves, 12 pairs, T1 to T12, originating from each of the thoracic vertebra. Okay, thank you. All right. The thoracic spinal nerves become intercostal nerves, which are the nerves that reach into the areas. Remember that when we talked about the ribs. Again, see how we are connecting the skeletal system with the nervous system. These nerves reach out and around to the spaces between the ribs. Okay. Then we have our lumbar nerves. What? 5 pairs of lumbar nerves numbered L1 through L5, just like L1 through L5, the lumbar vertebra. Okay. All right. But remember, the spinal cord ends right here. And then we have these other nerves that are all originating from the cauda equina, which is, and when you look at the picture in your textbook, okay, you will see that the spinal cord ends, and then all those individual nerves that were contained within there that were, feeding off, all the rest of these nerves come out of that area to then branch off through the lower half of the body, okay? And cauda equina, for those of you who may know, is the Latin term for horse. And so cauda equina refers to a horse's tail. Cauda, tail, equina, horse, okay? And when you look at how these nerves like kind of burst free from the spinal cord and then come out, it looks just like a horse's tail, okay? And so then we have the sacral nerves, 5 pairs of sacral nerves that come off of S1 through S5. Remember that a baby is born with 5 sacral vertebrae, which then fuse together by the time the person is in their mid-20s, okay? So, but those original parts still have their own nerves that will go out. And then the coccygeal nerves at your coccyx, your tailbone, 1 pair originating from there, okay? All right. And that is the end of the central nervous system. Now, as we talked, remember, we were talking about the cervical pairs of nerves and the thoracic pairs of nerves that come around into the intercostal spaces between the ribs, and then, of course, the lumbar. So those outreach nerves are known as the peripheral nervous system, kind of like those access roads that come off the interstate in your town, right? And so you have the interstate, that big 4-lane, 6-lane highway, and then off of there are your exit ramps that go onto all of these little roads so you can access those distant areas. That's exactly what the peripheral nervous system is, okay? So part of the peripheral nervous system starts in the brain, and these are your cranial nerves. And the cranial nerves, which again come off the cervical plexus, the brachial plexus, the lumbosacral plexus, also referred to as the lumbar plexus and the sacral plexus. We just talked about where those junctions are for those peripheral nerves. And each one has a different job. So in the cranial nerves, you'll notice, okay, olfactory, remember that's smelling, optic, seeing, oculomotor, which is the movement of your eyes. So you can see forward, you can see to the right, you can see to the left. You have your peripheral nerve. Okay, so you can see that each one of these individual nerves, 12 pairs of nerves that originate from different parts of the brain that are in charge of processing all of this information. Seriously? And then as we talked about, the cervical plexus is going to send nerves through your arms, right? We have the nerves that come off into your intercostal ribs. This is how you get to feel way down into the pads of your fingers and the tips of your toes. And you can blame that feeling tips of your toes for that excruciating pain when you're walking barefoot and you ram your toe, one of your toes, into the coffee table, which I just did 2 nights ago. All right. Remember, the only way, this is so much information. Are you kidding me? Okay, so you got to review it often. Unless you're Spencer Reed from Criminal Minds or you're Sheldon from Big Bang Theory, there is no hope that you are going to sit down and remember this. Memorizing this is not the path to future success. You are learning a new language, so you got to review it often. You got to make flashcards, review them on the bus, on the subway, in the car, as long as you're not driving. Okay? All right. Maybe even get a tape or a tape. I'm sorry. I'm showing I'm showing my age. Find an app that has audio. I bet there is one. Medical terminology. So if you are driving, you can listen to that and repeat after, right? This is how you're going to learn this new language. Okay. Oh, maybe we'll get Babbel or one of those language places to teach medical terminology. But that's exactly how they do it. They say, okay, frontal lobes, and then you repeat frontal lobes. Okay. That's how you're going to learn this. All right. Use your medical dictionary. It is not cheating. It is part of the learning process. You do not want to rely on your memory, as I just said, okay, because you want to make sure that you're reviewing and repeating accurate information. All right. And then whenever you need to, ask me. Say, I'm not sure, or I found this means this here, but it means that there. How come? And I will be happy to explain it to you. Okay? All right. And remember, at some point, we all become patients or the loved one of a patient. And this is important for your own understanding of your own body and a loved one's body. No, don't make that X-rated. Okay, whenever you have a question, please email me. I love it when you have questions. We can email back and forth. We can have a phone appointment. We can do Zoom one-on-one. We can do FaceTime, whatever. Okay, I'm here to help you learn. That's the important thing. Have a great day.